So, following the hematogenous seeding of the pericardium, there are four pathologic stages of tuberculous pericarditis. The first stage, which is serosuffusion, is a stage which is characterized by fibrinous exudate, which develops in the pericardium. There are a lot of neutrophils found in the effusion and relatively abundant bacteria and loosely formed granuloma. An effusion is already an exudate at this stage. However, we clinically rarely see patients present in this stage of the disease, as typically it is asymptomatic. The second stage is the serosanguinous effusion. In this stage, the exudate increases in volume and becomes serosanguinous. You've seen a shift from neutrophils to predominantly lymphocytes and monocytes in the effusion. And without treatment, about 50% of the patients in this stage will reabsorb their pericardial effusion and go on to stage 3. Stage 3 is the fibrinous stage, and this is where the exudate/pericardial effusion is absorbed and granulomas mature and caseation and the pericardium thicken with accompanying fibrosis. And the final stage, the constrictive pericarditis stage, you see ongoing fibrosis, which leads to pericardial constriction histologically. So the reason I talk about these pathologic stages is that they explain the clinical manifestations of the disease. There are three clinical forms of TB pericarditis. There is the typical effusive form, there's effusive constrictive pericarditis, and there's constrictive pericarditis. Effusive disease accounts for about 80% of all cases and is characterized by the gradual accumulation of pericardial fluid, which may eventually cause tamponade failure. Patients with effusive disease are typically in stage 2 of the disease, and this is the most common presentation. Again, the pericardial fluid will typically show elevated lymphocytes and elevated protein. There'll be an exudate, and the effusion will be serosanguinous. About 50% of patients in stage 2, as I already mentioned, will reabsorb their effusion and go on to stage 3. It is these patients who will benefit most from adjuvant steroid treatment, as we will discuss later in this lecture. Now, there's an interesting entity called effusive constrictive pericarditis, which affects about 5% of patients, and we'll talk a little bit more about it in the next slide. The third clinical entity is constrictive pericarditis. Constrictive pericarditis is found in about 15% of patients at the time of diagnosis and complicates 20% of all patients with tuberculous pericarditis despite anti-TB treatment.